Miss Alix Naginski, and she's joining us from United Kingdom, and the name of her presentation is Urgency of Integrating Mental Health in Clinical Practice. Ms. Naginski, the floor is yours. Please, you may start with your presentation. Just switch on your microphone, please.
Yeah. Thank you so much, and hello to everyone. As said, I'll be talking about a research project that myself and Dr. Bhattacharya have been completing on the topic of needing to use Ayurveda in clinical settings, specifically in the setting of psychology. So Ayurveda is a science that emphasizes the importance of balancing the mind, body, and spirit in order to achieve optimal well-being. However, this type of practice does not find itself within the walls of hospitals, but only for those who seek it. And only those who seek it have access to it in the USA. So considering patients are turning towards traditional medicine in the USA, because we've seen an influx and an increase in its interest in patients, where do practitioners stand, those of Ayurveda in the USA, and what are they legally allowed to practice? And so those are the types of questions that we couldn't really find answers to. With the current findings in medical research, modern scientists have begun to identify and comprehend the components of the multifaceted link between the psyche and physical health. However, this is obviously not new for Ayurveda, who has practiced and treated patients' mind and body together for many, many years. One example is a link between those who have autism spectrum disorder and symptoms of gastrointestinal issues. In modern science, in modern psychology, we have started to understand this link, obviously not new in Ayurveda. So understanding that one is unbalanced when the psyche is unwell and the physical is unwell is, as I said, something we could learn from Ayurveda. And so how much more could we actually learn from this traditional medicine, and how could we integrate it in the world of psychology? This is obviously not to discredit or forget about past research that has highlighted the effectiveness of Ayurvedic treatments for many psychological disorders, such as ADHD and PTSD. For example, yoga has been an example of great interest for scientists, and its benefits has repeatedly demonstrated to be of great use within the realm of psychology treatments. So why have we limited the research publication in Western journals to the specifics of homeopathic medicine and only its treatments? Why have we not learned more about its practitioners? And so how can we promote the integration of teaching within modern psychology? So that being said, our study opened in July of 2021 and was composed of 10 semi-open questions, and it focused on questions through the eyes of practitioners. We had a total of 137 participants, of which 121 saw patients with mental health disorders. We asked many questions about treatments, legal guidelines, and conditions being seen. And so, as you can probably see on the bottom left here, we had significant trends in the types of patients that were being seen in our original survey, such as cancer, elderly patients, pregnant individuals. And so we wanted to further kind of understand the specifics of psychology. All the data was then analyzed using Python. On the right here, you have the first page that participants would see when first starting the survey, which was just the guideline of what the survey was going to be about. So here we have the descriptive results of our data. The conditions being seen were reported to be very broad, with some seeing patients with ASD, autism spectrum disorder, some treating substance abuse, and others treating disorders that did not exist in modern medicine, such as Ummada. Please excuse my pronunciation of all Ayurvedic terms. But you may notice the mention of certain diagnoses that are not at first psychological, but we considered them to have psychological value due to the link between the physical and the psyche, such as, for example, headaches and migraines, which are known to be in patients of PTSD. We also included, I think, chronic pain, and then cancers as well, which Dr. Bhattacharya considered to have a very large psychological value for patients. So that being said, obviously, then you could often argue that all disorders are therefore psychological because there is a link, but we had to obviously, break it down. Then here we used years of experience, because obviously some practitioners are born into Ayurvedic families and therefore learn from a very young age. But as you can see, we have a majority of practitioners that have been practicing for more than 10 years. Then going on to the treatments, practitioners all used a variety of treatment methods in their practices, with 41.7% using MAMA therapy, 61.7% using Virachana, which is very interesting because, as I briefly mentioned, the brain-gut axis, which is a new finding for modern psychology in children, is when there's an altered microbiome, which holds a crucial role in the toxins present in the gut of the child and therefore increasing their chances of developing ASD. This has been understood to be a gross symptom of ASD patients, and therefore, how could we use Ayurvedic treatments to lower the symptoms of children with ASD? Moreover, more recently, a group of scientists from Helsinki University have found that a specific strain of bacteria is more likely to cause Parkinson's disease. Once again, how can we use this treatment to aid neurodevelopmental disorders? Both of these examples are what we call somatic symptoms within the psychological world. This demonstrates the need for the mind and the body to connect, to be treated as one within psychological patients. And this is still a concept being developed within modern medicine, which has been separate for decades. 97.5 use dinacharya. This is once again a very strong find. In modern psychology, the use of diets, routines, and other lifestyle modifications have become a very favorable manner to lower symptoms for those with particular disorders. And also the kind of trendy, balanced life that a lot of people desire is all about keeping a routine. This method of dinacharya is heavily used in modern medicine, but under a different term. And so we need to learn more from what dinacharya actually is and stop using terms that are too broad. Then, if we look at the sense of legal protection, this was in order to understand the current, for practitioners, what did they actually understand about their knowledge around the Health Freedom Act? And this revealed two very interesting finds. The first is with regard to telemedicine. So individuals did not feel as if their medical practice was compromised. And 100% of practitioners felt legally protected in the USA, yet only around 20% compromised how they're diagnosed and treated their patients. But that being said, 47.1% of respondents seeing mental health patients knew actually of the Freedom Acts within their state, which means that only less than half actually understood the standing of their legal rights when practicing. So one can wonder if these participants could regain access to their full practice potential if they knew the laws of their state, or whether this compromise is due to the current laws that their practices are located in. Also, this whole subject about legal practice of Ayurveda in the US is sparked numerous critiques due to the difference in diplomas. What are they actually allowed to administer with drugs, treatments, etc., due to the fact that there's a lot of regulation around that in modern medicine. Also, ethically, there's a huge issue with regard to the scrutinization of this act due to the fact that practitioners are still practicing with their full potential, a lot of them, even though they may not legally be allowed to. Oh, sorry. Finally, these are final findings. So the health professional trainings really was kind of all over the place for Ayurvedic practitioners when it comes to their modern diplomas. And as we can see here, more than 50% of practitioners seeing mental health patients have Ayurvedic training alone, which means that they feel comfortable enough with their training to see psychological patients. And what does that really say about psychology then? How would we then integrate individuals in the psychological domain when their diplomas are not equal, or not equal in the American sense, obviously, not scrutinizing any diplomas? Also, we included the mind body energy therapies, non-mind centered training here, 21.5%. And so, with that being said, we need to find collaborative treatment plans in order to move and innovate medicine forward, in order to integrate psychological and medical domains together. So the research findings suggest that Ayurveda has a great potential in promoting mental health and well-being. And by incorporating this in Asian practice into modern psychology, we can offer patients a more holistic approach to treatments, but also promotes a faster recovery to certain disorders. Furthermore, the implications of our research extend beyond just mental health. Ayurveda offers a unique perspective to the mind-body connection, which could have significant implications to other areas of healthcare as well. There are many limitations to the integration of in traditional medicine, however, such as the standardization of research and diplomas, the lack of research and practitioners to understand their perspective for the future steps to take forward. And then finally, the fact that some studies focus only on treatments such as yoga, meditation, and that needs to be expanded to help integrate practitioners into mainstream medicine. At the bottom here, I also added a few future questions or research that could maybe spark further integration. But that is all. Thank you so much. These are my references that I used with Dr. Bhattacharya for our introduction and throughout our research project.
Many, many thanks to Alix Naginski. And actually, Dr. Baswati Bhattacharya is just one level below. She's presenting and she's on the board just downstairs. So it was great to have you both here and to be able to, to hear you both and see that you cooperate. So it's great. Thank you very much to United Kingdom, Ms. Alix Naginski.